The Brown Adult Reconstruction Fellowship has really expanded and grown. We've moved from 1 fellow to 2 fellows. We've increased the number of faculty and training opportunities. We are so honored to have earned the ACUS Fellowship recognition. It really shows the dedication of our teaching and faculty, our dedicated curriculum, our case numbers and complexity of cases. Our fellow this year is doing over 600 cases with more than 20% revisions, which puts us at the top tier of any program out there for arthroplasty training. We have a unique model. It's called graduated autonomy.
It's essentially in 2 phases. The first half of the year, the fellows work very closely with the faculty, learning steps and thought processes, learning every approach to the hip, learning different techniques for knee replacement, some mix of robotics.
Slowly, we move you to doing cases on your own with our supervision.
Not just doing these cases, but also thinking about them and planning for them. That's where things change into the second half of the year, where the fellows start to book their own cases, they're managing their own clinic, and they're indicating cases with our guidance and our help.
A lot of things drew me here, actually. I was looking for a well-rounded fellowship experience, a place that had all the contemporary hip approaches, primary knee, revision knee, basically the whole gamut of arthroplasty experience, high volume outpatient stuff, getting access to the business aspect of a private practice model, as well as the academic tertiary care referral center volume.
You have exposure to robots, to anterior approach on a HANA table, on a regular flat table, all types of revision hip approaches. As a result, the fellow gets to decide what he or she may want to do in practice and what's the best approach for them.
They allow you to have the freedom to move around to see the things that you feel like you need to see. For example, if you're coming into a fellowship and you've never done an anterior total hip replacement, you have the ability to go and do as many of those as you want with the guys here who do anterior replacement surgery, which is pretty cool.
You're not just following behind an attending and shadowing an attending, learning steps and functioning as an assistant in an operating room. You're functioning as an adult reconstruction surgeon, which is a huge difference.
Where we are a huge catchment area for all types of arthroplasty problems and disasters. This allows lots of experience for the fellows, seeing lots of complex cases.
We're affiliated with the only level 1 trauma center. Traumaplasty, as it's become more and more popular, a lot of that does fall onto our faculty and to our fellows. And so they get experience with this wide range of hip and knee replacement cases and trauma as it relates to total hip and total knee arthroplasty.
Starting out in practice, you're not going to necessarily get the slam dunk easy cases, so you need to feel comfortable doing all those cases. And part of that is the training here. You feel comfortable to address complex cases.
The other nice feature is the independence you get. I left this fellowship doing 15, 20, 30 total joints on my own. So when you walk into the operating room the first day and you're truly on your own, you don't feel that nervousness and you feel prepared, because having done that here under guidance and supervision, but truly in your unique way.
We were the first in the state to start an outpatient arthroplasty program, and we continue to grow our outpatient arthroplasty volume. Our facility is state-of-the-art. Our outcomes are top-notch. Outpatient arthroplasty, that's going to be critically important experience for fellows coming through as more and more practices push towards ASCs.
We're just starting our total joints program, very similar setup to East Bay, so I was able to learn some valuable lessons, not only in how to do surgery and the protocols, but also how to set up a surgery center. They're very helpful, they're very open, they shared their protocols, they showed me how it works all along the way, so it was extremely helpful.
When they go into practice, they feel they're really well prepared to tackle anything. They feel they've gotten the practice management side and the business side of medicine and orthopedics, which oftentimes we don't get as residents.
We really focus on the 360 degrees that are required to be a successful hip and knee replacement surgeon. It's not, can you get through a case? It's far more than that. It's how do you build a practice? How do you indicate a surgery for revision and deal with complex patients, and even simple things like setting up a room? Those things we push our fellows to learn, because when they get out of here, they're the captain of the ship and they need to be able to function wherever they go without any oversight.
We have tons of research opportunities here at Brown, being an academically affiliated institution. We like all of our fellows to complete one research project while they're here. Otherwise, it is totally up to the fellow how much research they want to be a part of. Our fellowship is located in Providence, Rhode Island, and I couldn't think of a better place to live for a year. We have close proximity to beaches, mountains, big shows, great restaurants, and great sports teams.
It's a small city, but it has everything you'd want. Nice place to kind of walk around. Everything's in close proximity.
Rhode Island is a phenomenal place to raise a family. A lot of different things to do with a family, whether you're into outdoor activities or the arts. I think there's a lot of different things here to keep everyone happy.
Providence is accessible to both Boston and New York by train or car, and very easy to go and visit for a day.
Going from a big city to a smaller city, I wasn't sure how that was going to work out because I loved living in Manhattan. But Providence is a really cool place because it's like a big city in a small place.
This is a lifelong fellowship. We have group text messages where we get x-rays and questions about challenging cases from all of our former fellows. We are all very happy to respond and give our own advice, something I think all potential applicants should be looking for in a fellowship program.
When something comes into clinic, you need to bounce your ideas and your thought processes off of somebody. It helps to have people who do it every day at a very high level in your speed dial. That's a huge part of what fellowship gave to me, is the network that I have now to call upon.
The attendings are amazing. They give you not only just guidance, but also friendship and their mentorship along the way. I've reached out to them multiple times over my 3.5 years.
It was such a formidable year in my life. I'm truly forever grateful for what they gave me and the network that I have and the skill set that I developed here. And I'll never really be able to say thank you enough because it really has made a huge difference in my life.